This is Dr. Johnson doing an after-the-fact voiceover from a treatment I did earlier today on a 19-year-old college student, softball player, who was bothered by these vertical bands and strands of shadows in her vision. They are indeed floaters. Kind of unusual because they don't usually treat younger patients. Their floaters are usually microscopic and closer to the retina. This is just an anomaly and a variation of what can be out there. So I was actually kind of surprised to see this, and I didn't see anything else in the eye to compete with it, and the pattern of these kind of correlated pretty well with how she described them. So I felt it would be prudent and reasonable to go after them with an intentionally light, kind of controlled treatment to where I just know that I've done something to it. Severed it, broke it, got the little knob on the one strand there to where I know I absolutely changed it, and then we use that, the results of that as feedback to help guide us as to whether we need to do more or whether we should do more at all or just stop and abort after a first treatment. So that's what we did. This is a relatively short 1.5 minute segment of an otherwise several 10, 12 minute or so procedure. At about 1.5 minutes, I took the camera off and just went without the camera. It's a little bit cleaner view on my side. But this does show up pretty well, and but you can also see that this thin little wispy strand is it's like rubber. It just is kind of taking a beating, and it's not really easily vaporizing or being severed. So even the ones that don't have a lot of mass or volume to them can be a little bit of a challenge as well. So anyways, we'll let this wind down. It's just a good example of some of the variants out there.